Hello, everyone. It's Dr. Matt Palladino. So, life without migraines, is it possible? So, I want to talk a little bit about migraines today. But first, I want to start with actually a personal story about myself and migraines. As having migraines is actually one of the things that kind of led me on a path of becoming a chiropractor and a functional medicine doctor. Essentially, what happened is when I was about 15 or 16, I was in PE class playing football. Went up to catch a ball. Someone swept my feet out from under me, and when I landed, I actually landed kind of on my head and my neck, and it really had a pretty jarring impact. And it was either the next day or 2 days later, I had my very first ever migraine where I lost my peripheral vision for a little bit, and it really freaked me out because I had no clue what was going on. I'd never had a migraine before, and then it went away. Good, it made me happy, and then all of a sudden the pain started, and that was the beginning of my migraine journey. And I didn't have migraines all that often, maybe one every 4, maybe 6 months for a couple years. But when I did get one, they were very, very, very severe. All I could really do is lay in bed, take some Excedrin migraine. But one thing I did find when I was younger that helped was getting adjusted by my chiropractor. That really seemed to make a big difference. And as I got older, I was able to figure out some other things that helped stay away from different triggers. But now, years later, 20 years later, I've been able to actually live a life migraine free. So I don't have to avoid anything. I haven't experienced a migraine in a very long time. So life without migraines, is it possible? I think for a vast majority of the people, the answer is yes. And so today I'm going to be getting a little bit more in depth about that and explaining how that's even possible. Um, Over the years, I've worked with literally hundreds of people who've had migraines, and I've really been able to work out what really does seem to work and what I guess doesn't seem to really be that effective. And there's always going to be factors. And one of the things about dealing with migraines is that everyone has different triggers, everyone's been through different experiences. So it's definitely not always a one size fits all approach. But what I'm going to hopefully do is explain a little bit about in a very easy way to understand what happens with migraines, why people get migraines, and so what we need to do to correct correct your physiology essentially, so that you're not getting them anymore. Um, so so there's a lot of stuff that's not known about migraines, and which can make them, I guess, difficult to treat. But one thing that we know is that there are more with this. There are more people that have migraines after head traumas or after some type of really stressful event. And so essentially, what is happening is there's different types of cells in our brain. There's the neurons, which people think of um, as the brain tissue, but also too there's another class of cells called glial cells. And within this class of glial cells, there's multiple different cells. There's microglia, there's astrocytes, oligodendrocytes. So there's multiple different types of cells. But what we find is that these cells, they have some immune function. They have some inflammatory capabilities. And after you have a head injury or maybe a really stressful event, some of these immune cells in our brain will essentially turn on. And once they turn on, they don't really turn off, and so then they're just, I guess, turned on for the rest of our life. And what that means uh, for your health and for migraines is that um, immune cells are one of the things that when they become active, they deal with inflammation. And so what you find then is all of a sudden you have all these immune cells in your brain that are activated, and then when they become in contact or they become stimulated by some sort of stimuli, like it could be food, it could be caffeine, it could be you walk into the fragrance section of a department store, then all of a sudden that triggers a migraine. It could be exercise, it could be stress, it could be lack of sleep. When our body is put under stress, and all of a sudden these immune cells in our brain then become activated because they're kind of on more of a hair trigger, then all of a sudden we get the migraine effect. So one of the things that I found very, very effective in helping patients with migraines is is really helping them calm their immune system down. Giving them some different supplements to help their brain, their body regulate their immune system, help quelch inflammation, not only in the brain but just in your overall body. And so one of the things too, I always like to give a short definition of inflammation because it's a huge buzzword. We hear about it all the time. You read an article, oh, this causes inflammation. You want a low inflammation diet, but what is inflammation? And so I would say that there's kind of two different parts of inflammation. I'm sorry, two different parts of the immune system. Okay, so and I'm not talking about the innate or the adaptive immune system. What I'm talking about is there's an immune system that we think of that fights off infections, but then there's also a part of our immune system that deals with repairing or replacing damaged cells or tissue, and that's when we talk about inflammation of the body, that's typically what we're talking about. So anytime, let's say you fall and you sprain your wrist, what happens? Well, the fall actually damaged tendons, ligaments, cartilage, and so what that means is at the cellular level, the cells that make up these tendons, ligaments, cartilage, muscles, uh, these cells actually become damaged, and when they become damaged, they release different signaling chemicals. And what those chemicals do is they go out and they tell the body's immune system, hey, there's some damage here, and that causes blood flow to increase to the area, brings in immune cells to the area. The lymphatic system is involved, draining away damaged material. And what this does is our body's way of repairing or replacing. It's like, if you get a hole in your roof, then all of a sudden what do? You call the contractor, then all of a sudden the contractor pulls up with a roofing truck, a dump truck to put the shingles in, maybe a dumpster, so all the and brings in, has the supplies delivered to repair the roof. And so that's essentially what's happening is when you have a damaged area, there is the body's immune system brings in the necessary cells, the necessary building blocks to repair. So when we talk about inflammation, I like to describe it as the body's immune process at repairing or replacing damaged cells or tissues. What that means for migraines is it takes very little stimulus in the brain to then cause an immune reaction. And when that immune reaction occurs is typically when a migraine then starts. And migraines can be really miserable. Like I said, I've had very bad migraines. I've worked with so many people that have migraines in the past. And I'll see a lot of patients sometimes, and they'll tell me that they struggle with migraines, but in reality, they don't actually struggle with migraines. Just because a headache is really bad or really severe, that doesn't necessarily make it a migraine. There's some things that we typically look for, um, things like losing your peripheral vision, seeing an aura. There's also too, I mean, there can be numbness in extremities, facial numbness. There can either even cause things like GI distress. There can be all sorts of neurologic symptoms because it's more than just a headache. It's an inflammatory, it's an immune response that's happening in the brain. Um, and just a side note too, I've had so many patients over the years who come to my office that have been prescribed different medicine, like maybe like Imitrex, and they'll tell me that, and I've never taken Imitrex, but they'll tell me that the Imitrex helps, but they don't like the way it makes them feel every day, and they would rather feel, I guess, crappy one day, 1 or 2 days a month, and feel good the rest of the days versus feel a little bit off all day every day, and feel off a little bit every day by taking the Imitrex. That makes sense. So, um, so what I like to do when I work with patients that have migraines is I do use supplements. I figure out what's going on. Some of the typical supplements that I'll use first off is magnesium. Most people are deficient in magnesium. I've read statistics up to 90% of the American population is deficient in magnesium. And magnesium is one of the most important minerals that our body needs in order to be healthy, for our brain to function. It helps regulate some neurotransmitters like acetylcholine. Um, there's all sorts of interesting side effects too when people are deficient in magnesium. One of them is migraines, depression, um, being lethargic is one, craving sugar is another one. And so just by taking magnesium, a lot of people can get a decent amount of relief from their migraines just by simply taking magnesium, and that's something very simple. Um, Another thing too about magnesium is you can't always get accurate levels by taking, I guess, by looking at the levels in the blood. The magnesium circulating in our blood doesn't always directly correlate to, I guess, how much of it is being used and being stored within the bodies, within the cells too. So even if you said, hey, well, I had a blood test and they checked the magnesium levels and they were fine, that could have mean that you just ate a meal that was rich in magnesium and you just have a lot of it floating around in your blood because a lot of it was absorbed. And I've also too found with magnesium that it takes time for it to I guess build up within your system. So if you start taking magnesium, you're going to need to do it consistently, and 3, 4, 6, 8 weeks for it to really build the reserves in your body to make a substantial difference. I recommend for that taking magnesium glycinate. There's going to be all sorts of different types of magnesium. Magnesium glycinate is the one that seems to be the one that's most gentle on people's GI system. And then also to recommend taking that in the evening. When you take it in the evening, it promotes a better night's sleep. If you take it in the morning, it's not going to make you drowsy. It's not going to put you to sleep by any means. But if it's going to help you sleep, you might as well take it at night before you go to bed and promote a more restful night's sleep. Another supplement that I really, really like that I've had a lot of success with giving patients is ginkgo biloba. So a lot of people have heard of ginkgo. It was a very, very popular supplement maybe 20-ish years ago. Rightly so. It has some amazing properties to it. One of the big things that it does is it actually helps you bring more oxygen to the brain without raising or increasing blood pressure. It's great for your overall circulatory system, brain, and nerve health. It's good for people if you're experiencing some type of like degenerative neuropathy in your toes, like a diabetic neuropathy. It's great. I will say though, it does interact with some medications like blood thinners. So if you're on certain medications, you definitely need to make sure that it's something that's okay for you to take. But essentially, allowing more oxygen up into your brain is really going to help calm the immune cells in your brain. And the more calm the immune cells are in the brain, the less of a chance you're going to be triggering migraines in your system. Um, Another one would be a flavonoid complex. I've had some really good results prescribing. I use an isoflavonoid complex. It has some different ones in it. Like a really common flavonoid is called resveratrol. Some people have heard of that, but those are also things that are really good for quelching inflammation in the brain. I don't use CBD oil, but I get asked about that one, and I've had some patients have some decent success. But same thing. These are all things that are helping to quelch and I guess suppress inflammation in the brain. And when those immune cells in our brain are way too active, those type of supplements really seem to help. The other thing that I've had really good success with is specific neurologic based chiropractic care. And what I mean by that is, not every chiropractor does the exact same thing. If you've been to multiple chiropractors, there's a wide variety ranges of types of care and what chiropractors treat. One of the focuses that I really try to hit on when I'm working with a patient with migraines is I guess balancing out their nervous system. And so what I mean by that is there's different parts of the nervous system. We talk about the sympathetic, the parasympathetic system, and with different types of chiropractic techniques, different types of evaluations, we can actually make sure that that those sympathetic, parasympathetic sections or parts of the nervous system are becoming more balanced. It helps your body deal with stress, helps your body regulate different parts of your system that deal with migraines. Also, too, we know that trauma does play a part in the migraine process. People who've had a lot of head traumas, neck traumas, whiplashes tend to have what we call cervicogenic migraines. So basically, their neck is really messed up, dysfunctional, and that's leading to things like migraines, headaches, vertigo, can lead to ringing in the ears. And so with chiropractic care, when we are able to restore normal function to the neck, to reverse some of the injury, some of the damage that was sustained during the accident, then we really start to see improvement in things like headaches and migraines. And so chiropractic care has been a huge part of my success in helping people get over migraines. And I will say that, not every chiropractor does the same. And so if you've been on chiropractic care, like I said, you'll know certain chiropractors do things one way, certain chiropractors do things another way. So maybe just because you've tried it, been to one chiropractor and it didn't really seem to help, doesn't mean that there's not a chiropractor out there that will be able to help you. So I would recommend finding someone that you trust and maybe ask if what their experience is with different chiropractors, and try and find one that really works for you. Find one that really evaluates the body, really tries to figure out what's going on, instead of and I hear a lot of patients go into different chiropractors or gone to different chiropractors, and they say they don't evaluate, they don't check, they just walk in, they crack my neck, they crack my back, and they put me on my side and crack my low back and my hips. And so, I mean, that can be fine if you're dealing with pain, but if you're really having a neurologic based condition, that might not or probably won't be enough. You need someone that's going to actually evaluate you, figure out what's out of balance, what's stressed, and work with you to get those normal levels of functions restored. So back to the title of the video: is life without migraines possible? For most people, yeah. Are there genetic factors? Yes. Family history matter? Yes. Uh, Diet. I didn't really hit on diet, but does diet matter? Yes, because if we're eating a diet that is highly inflammatory, um, then our body's going to be more inflamed, including our central nervous system, which includes the brain. And when there's more inflammation in the brain, you're more likely to have migraines. So even diet can make a big difference. So those are some things that I do when dealing with patients. We can definitely get more in depth. I definitely get more in depth with certain patients if their migraines aren't clearing. There's all sorts of different avenues or approaches that we can do, but essentially the two main things that I've found are completely necessary to help alleviate migraines so people can live without migraines, without the fear of having migraines, is one, we have to calm the nervous system in the brain. We have to maybe find out what the triggers are. We have to use supplements or nutraceuticals to help bring oxygen to the brain. Even exercise is great for people who have migraines because it's just bringing more oxygen to the brain. We're helping stabilize the neurochemistry of the brain. That's vital. Also, too, if your migraines are due to some type of trauma, some type of whiplash, some type of concussion, you have to fix the dysfunction that resulted from the accident. I mean, there's going to be tight muscles, there's going to be joint dysfunction, there can be tendon ligament dysfunction, there can be pinched nerves, there can be all sorts of different problems stemming from those injuries, and they have to be reversed in order for there to be proper blood flow in and out of the brain, proper nerve flow in and out of the brain, proper cerebral spinal fluid flow in and out of the brain. There's all sorts of stuff. It can get pretty technical, but life without migraines, is it possible? I say yes for pretty much everyone. We just have to find exactly what works. If you have any questions about that or know anyone that has migraines, hey, send them this video. I'd love to talk with them. I'd love to be able to help people with migraines. That's really one of my favorite things, that type of patients that walk through the door, just because I honestly haven't dealt with a lot of back pain. I haven't dealt with a lot of neck pain or some of the issues that I help people with on a regular basis. But one thing that I have dealt with personally that's really affected me is migraines, and so being able to help uh, people who suffer from migraines is one of my favorite things to do. It's one of the most rewarding things that I get to do in practice. And I see such high success rate in helping people, get over migraines, either 100% or just maybe see, 80% improvement, 70% improvement, 50% improvement. And people who suffer from migraines, you'll take anything you can get. But I have such a high success rate. It just blows my mind that more and more people aren't coming to doctors like me, functional medicine doctors, specific chiropractors who do very specific neurologic based chiropractic in order to get their migraines corrected. So, any questions, feel free, let me know. I'd love to answer them for you. I'd love to help you out. Hope you all have a great day.